We are live on YouTube as well. So, good evening, everyone. It's a pleasure to invite you for our next Parental Alienation Awareness webinar. It's a special event because this program is officially been inaugurated by Indian Child Abuse, Neglect and Asylum Wing within IAP, that is India Academy of Pediatrics. And, they recognize the situation of parental alienation, and we have two esteemed distinguished faculty within us, Dr. P. Ashok Kumar, the chairman of ICNCL, and Dr. Ramesh Tanvi, sir, both of them. I welcome first Dr. Ashok Kumar, sir, to give a welcome address for this inaugural session, sir.
Thank you, Dr. Natesh. And it is present very happy to be part of this initiative. I think we are working with Dr. Natesh for a few weeks now. We are working together on this area. I must thank him and his team for giving us an opportunity and preparing ready to work with iCancel group. I think in the beginning it is proper for me to say a few words about the Indian Child Abuse Neglect group of Indian Academy of Pediatrics. This is a subspecialty group of Indian Academy of Pediatrics, which was started almost 25 years back, and we are working. It's a multidisciplinary organization, not only for pediatricians. All the disciplines who are interested to work with the area of child abuse, child neglect, and other social issues can join this organization as associate or affiliate members. And we have almost 1,000 members now, and we are working in all over the country with a lot of state branches and all. And we have a lot of programs, and we have started with our training for POXO, for medical professionals, organizations, and all. Now, last year we have started, Indian Academy of Pediatrics has started another major initiative for IAP initiative to prevent violence against children. And this is again a multidisciplinary task program, even though not directly under Indian iCancel group, but it is IAP directly doing its program. We focus on different violence against children and how the medical professionals should recognize and respond to such an issue. And in this context, especially when we are talking about the parental alienation and the neglect and emotional abuse, this is again a very, very, very important topic. We always talk about physical abuse, sexual abuse in many forums, but this child neglect or rather emotional abuse is not taken in the forefront in many of these discussions. And I'm extremely happy that at this juncture we are able to join hands with so many organizations like Trichy, IAP, and the Psychiatric Association, and we have a lot of other people, interested people are coming together, and this is how we can work together. And I'm extremely thankful to Dr. Natesh Prabhu and his team for help joining with us. The iCancel group is now trying to move further in many areas, and even though my term is going to be over by the end of this year, Dr. Ramesh will be continuing as the secretary, and I will be there also in the team. So we will work together, and we focus on, if possible, in different states, and depending upon the regional requirements also. There need not be a same issues all over the country. So it may be different at different places, and we should work together. And I request all these people who have joined this forum, as well as others who are interested also, you can also join the IAP iCancel group as affiliate members, so that we can work our sphere of work to a more extensive way. And I think I think we have today, I think we saw that the details of the speaker, Dr. Bhagyavati, is an expert in child and adolescent psychiatry. And it is, I would like to hear from her how this emotional abuse part and how the judiciary should look at it. This is a point which we have, again, when we talk about the sexual abuses also, the judiciary, they also have to understand where the child is standing and how to respond with that. Not only the medical professionals, so the advocates as well as the judges also should know how to work with these people. And this is an area of, we have a lot of things to do. And coming together with all these multidisciplinary organizations, we will be able to do good to the children in the future. thank Dr. Natesh and his team for giving me this opportunity. And I formally inaugurate this webinar series and hope that this will spread more into the pediatricians and other medical professionals so that we can work in the future also. Thank you, Dr. Nadesh, and we will listen to Dr. Bhagavati Madam. Okay, thank you.
I welcome Dr. Ramesh to say a few words and now the program.
Good evening, all. At the outset, I welcome Dr. Natesh. He has become an affiliate member. He joined iCancel group. Am I audible, Natesh?
Audible, sir.
Right.
Please.
So he joined iCancel group out of his passion for these activities. So whatever we do, I have seen the topic. So till now we are doing, as Ashok told, we are doing the awareness to the doctors, everybody. But what I feel, coming together will be a great success. And we should actually do at the community level and to the parents and to the neglected children or single parents or single, because at Telangana, I was the consultant for women development child welfare for almost 4 years, where I have seen a lot of orphanages where they need a lot of counseling, emotional support, everything will be there. So there are two issues which next year from our iCancel group, we want to go to the community level. One is creating awareness in the medical fraternity, because most of the pediatrician, for that matter, any doctor, they will see clinically only, but they don't see this is something like a neglected part in the medical profession. So abuse, neglect, and child labor, which usually we think it is not our job, not the job of the medical professional to address these issues. But if you go to the community, there are a lot of issues will be there. And particularly if you see the orphanages in the government sector, whether it is government or public sector. So we will be going to the next year to the community level. Even at the national level, we are advocating to have at least one orphanage adopted by one association, one branch at the national level, so that we can do some actual counseling, actual guidance, handholding to the children and to the parents. With this, I congratulate Matish and all the speaker. So I have another meeting. Kindly permit me to leave. So we will do work together, Natish, in future. Next year we will do more. Actually, this is one part. Creating awareness in the healthcare provider is one, and actually going to the community and giving a handholding and helping hand to the needy people is another part, which we will do next year. Thank you.
Thank you so much, sir. And thanks for inviting our members, because we have a lot of single parents here and they're looking forward to join iCancel as an appeal member also. So with the permission, like I can share the link, the membership link, and you can scrutinize as per the requirement. Thank you so much, sir. Thank you. And it's an honor to welcome the next speaker for our program. And Madam, you need to unmute yourself.
Yes. Yeah.
So Dr. Bhagavati Madam, she has finished a MD and DM from NIMANS. She's an adolescent and pediatric psychiatrist. She's currently HOD of the Department of Psychiatry from Mandya Institute of Medical Sciences, Karnataka, Mandya. And she's one of the experts in the field of managing this field of child emotional abuse. And she has her own center in Mandya. And it's a pleasure and honor to have her with us. And today's session has two important significance. One is the involvement of iCancel group as a collaborative body, as an organizative body. And second, we have got the Karnataka High Court guidelines, which have recently adopted the shared parenting rules of the Kolkata guidelines. So, trend is shifting. Child visitations or custody is no more a privilege of the alienating parent. It's a right of the child. So, we are here to create more awareness of this is not to happen. And things are going right with God's grace. And I welcome you, madam. Please, share the stage.
Thank you. Thank you, Natesh. Dr. Natesh. I am having great pleasure to be part of this group. Actually, I was not aware about. Can you able to hear me?
Madam, you can hear you, ma'am.
Okay.
You can share a PPT. Ready?
Yeah, I'll start. Share. All also share system audio. 1 minute, help me. Hmm. Hmm. Go to share. Enter screen. Huh?
He can show his face. His side.
Hmm. Got that. Hmm.
You can come front and show the face. No issues. Please come on front. There is a share button over there. Just click the share. It's easy. So meanwhile, members, you can just visit ICANN's website. I'll be sharing the link in chat box. You can look out for the criteria for being a affiliate member, because as Dr. Ramesh has said, we need to take it to the community. It requires a lot of social work. It requires a lot of multi-disability, doctors, social workers, the parents. So this has to change. This is changing, and we are happy to be part of the bigger change. And I can share the link, the chat box shortly. Ma'am, or you can share a PPT to my WhatsApp. I can share it on your behalf. In case if there's any difficulty for you to share the screen. Namaste, Vikas ji.
Hello. Just
Ma'am,
I know. Just now I shared the through WhatsApp.
to WhatsApp, let me see.
Yeah.
Yeah. Yes, sir.
Why it is not coming?
Just a minute, ma'am. Meanwhile, you can share some of the experience and demands, because like in today's order, they have mentioned the role of expert advice from demands.
Okay, sure. See, as a child psychiatrist, we discuss a lot on child trauma, abuse, neglect, but we won't discuss parental alienation as a kind of abuse. Actually, it's a silent form of emotional abuse on children, but never come in a forefront for a discussion. So this is very good platform for me to share and understand in depth about these things. Yeah, in child psychiatry in NIMHANS, we used to see a lot of children presenting with behavioral manifestations, especially for going through the child sexual abuse. So, and children with conflict in law. Those children we used to see in a forensic child psychiatry aspect. So apart from that, regular discussions on child mood disorders or psychotic disorders or OCD, majority of these cases used to kind of very severe form of problems, very difficult to manage kind of things. The people used to refer cases when child develops some complications. It's all severe form of disorders we used to see. So during throughout my whatever training, this topic discussion we never had. That's one surprise for me. So that's one of the opportunity for me here to share these things and understand more point of view of the parents also. Though those going through this.
We have a lot of
By,
labs in them. They're waiting to ask more questions to you. Yeah.
yeah, yeah. The rejection by the child will is difficult to digest by the parent,
Yeah.
especially when they're not done anything to child
Hmm.
per se. Okay.
Now the
So
PPT is ready now. Please.
okay. So
Visible, right? I can get in it.
yeah, yeah. I am just okay. This I cannot change, right?
I will try giving you the access, but you can doesn't matter.
Okay. Fit to window. Okay. So as I said, that is the first slide. Go to first slide. Yeah. So, as discussed, yeah, this is a kind of silent form of emotional abuse in children. It goes unnoticed many times because of the high conflict separation of parents, especially in a child custody disputes. So, it is a kind of invisible trauma to child, but it leaves a very lifelong psychological scars in our children. So it usually we don't, as I said, we don't discuss in a regular academics about this topic because maybe I feel it is not part of, not included in our classificatory system like either DSM or ICD. We never see this concept in this classificatory system at all. So, with this, we will just discuss today's topic that is parental alienation, a form of child emotional abuse, which impact on child present and future as well, and urgent judiciary order for shared parenting. So, we'll have this discussion. First, I'll go through the few minutes and then come to a conceptual overview of what is parental alienation and its impact on child mental health, both acute as well as long term impact, and what is shared parenting and how judiciary needs to urge for it, and how it will help the child as well, and coming to lastly few conclusions.
No, I given you the
Can
access.
I
You
go
try
to
clicking next. I given you the access.
yeah next?
You can click next from your mouse.
Yeah, can you go to next slide?
No, I have given the access.
Okay. Yeah, coming to this case, Vignet will is a 10-year-old girl child where parents are divorced 2 years ago. Father had a kind of alternate weekend visitation. Child used to initially has to enjoy the visits with his her father, but later on developed kind of rejection towards father because sometimes crying and refuse to go all that. So that is mainly because there are the silent dialogues coming through the mother, like she used to tell, "I feel alone when you go," or "I have no one except you." This very mild form of dialogues, but gives a very strong impact on child emotions. So for that, the reaction is like next slide. Uh, Next slide, please. How to control this slide? Natesh?
Yeah, you can
Yeah,
change over there.
yeah. So how this child react to this is like child feels that I am making my mama sad. So she feels very tense and guilty at times. So she the even though child has an affection towards father, it becomes very anxious when she needs to go, or when she gets some calls in between when she is with the father. So what it interpret is like it is slowly mother is inducing kind of guilt feeling in the child. It is like child feels that she is responsible for mother emotional sad feeling, and also develops kind of loyalty conflicts, whether I had to be very loyal to mother because she is feeling she is taking care of me. That kind of slowly develop kind of resistance towards father. So this is a kind of reactions will be built over a period of time very slowly. It is not something which is harsh way, or in a what we see in a abuse or neglect. It's a harsh kind of hard kind of emotional abuse, whereas here it is very silent form of emotional abuse happens. So like that, another case we neglect. So I'll just go to next slide. um, Okay, here a 8-year-old boy. He is also his parents also separated, having a shared custody between both the parents, where father used to have a very frequent negative comments, like in presence of child, like your mother never care about you, she is always busy. So you better off with me only. That kind of what comments from the father again affects the child. So what child says is uh, outrightly reject the mother when she is with the mother, like father said that you never care for me. So it is unjustifiable. So there's even though in the absence of abuse or neglect from the mother, just because father is telling these dialogues, child repeats the same thing. So that go to next slide, please. So this is another kind of the kind of impact in child's mind by the dialogues by the father. So it may not be only with the father or with the mother. It happens from both the side, especially who takes the dominance, or who raise more want what kind of insist the child or influence the child. So that kind of that they become dominant. So it is also silently a kind of abuse, as well as child is sandwiched between the two parents. So it's very tough time for child to go through, especially when child is still developing. Their mind is still developing. They don't know the what real experiences. It is they will experience all these through the dialogues through the parents. So it's a very young mind will be distorted during their development itself. Okay, so this is a kind of case vignettes you can see. Can I go to next slide, please? How can I control? Okay. So with this background, we can see how parents are influencing either father or mother of the child innocent mind. That is called parental alienation as such. So it is a process where one parent influence the child to reject, or to fear for other parent, or to avoid the other parent contact, So it is when parent consciously or unconsciously manipulating. Sometimes even a parent themselves don't know whether they are manipulating, because they themselves are going through lots of frustrations and conflicts between the parents. So without their notice or without their conscious, they just tell something, some dialogues to parents, that itself also will have a kind of alienating towards the other parent. So go to next slide. So this kind of behavior is typically arise during the divorce or separation proceedings, so where which manifest in child a kind of unwarranted fear or disrespect to other parent. So the kind of respect they had, slowly they will lose the respect because the other parent is in seeding some bad things about the parent, so are hostile towards the other parent. So these are the kind of uh, manifestations we see in the child while going through this process. Go to next slide. So then what happens? There are different forms of alienating behavior. Maybe through the negative speech, what we have seen in this case, vignettes. One parent is telling she doesn't care about me, or other parent telling that I'll be sad. So that kind of negative speech, what makes the child to uh, create a doubt about the other parent. So slowly they will resent from the other parent, or they will be having, the parent themselves will be blaming each other for the divorce. They will tell my father did this, that's why I divorced. So that actually child is uninvented. Those dialogues child is not invented at all. So it comes through spontaneously from the alienator parent, or it is sometimes it is interfering the visitation itself, avoiding the contact with the other parent, or slowly inducing guilt, as you see in the case vignette, inducing the guilt on the child mind. So this is a different forms of, this is a varieties of form. This is just a one or three or four list I have made, but the kind of list goes endless. This kind of behaviors induction by the parents each other. So go to next slide, please. So what happens, how with these between these parents, what happens on the child is leaving the long lasting psychological scars in there and sandwiching between these two parents. So that's what the child goes through with this parent alienation in actually. Go to the next slide. So how it is evolved, we'll see how this parental alienation word has come into discussion. So it is mainly the larger work done by Dr. Richard Gardner. He is a child psychiatrist and psychoanalyst in a Columbia University. He has wrote many chapters in a books and many articles about this. He was a very long expertise on this child custody and analyzing the child alienation and denigration especially. So he has coined the term this parental alienation syndrome initially. Whereas it has gone so much discussion whether this parental alienation syndrome need to be labeled as a diagnosis or not. So much discussion went on, but at least he has given so much inputs about this parental alienation syndrome, how the patterns happens in the children, how to identify, how to interfere in the early course of this. All this has given by Richard Gardner. The rich experience by him has come into play so much, helps to help the child during this process. Go to next slide. So here, what parental alienation syndrome, in which one parent, that is alienator, who try to influence the child, is called alienator. Who is rejected by the child is alienated. Okay, through the manipulative behaviors. Okay. So this is observed mainly in a child custody disputes we already discussed in a family courts, especially it happens. Go to next slide. So here what happens? Um, Go to next slide, please. Yeah. So go to next slide, please. Here we can see the before alienation began, this boy was looking forward to the weekends where he was enjoying both the company, well, either father or mother. But what happens over a period of time, uh, that becomes hatredness develops and rejection and fear, all that develops. So initially it is very slow, or after that it becomes a forefront child's life. So this is how it is. Patterns of emotional abuse happens in the child. Go to next slide, please. So with this process, during this process, how the this parental alienation syndrome undermines the family bonds. So how means slowly child lose the respect towards one parent. So slowly it will disregard the one parent through the dialogues or whatever, or claiming the exclusive love by one parent makes the child to feel loyalty conflict with other parent. And also the sometimes these parents will be having self-centered this thing, uh, so that they will try to indulge as much as possible the hatredness or bad about the other parent. So without knowing what happens by doing this, what happens on the child mind. So this is a very important thing what a child goes through during this period. Goes to next slide, please. Yeah, it not only affect the emotional aspect, it also affect the cognitive and other emotional response. Over a time, it becomes what happens in child is these dialogues are uninvented, as well as the child started developing confusion, because what he is experiencing with the one mother, what is told by the other parent, will be very contrasting. So child develops kind of very confusing state in his mind. So go to next slide, please. Yeah, so child develops kind of internal conflict among themselves. So whoever alienating, their voice becomes very strong, whereas child inner voice become weaker and weaker, because it is so much dominating dialogues is coming from one parent. Child emotions becomes very weak. He began started doubting his memories, like he might have had a very good warmth and love with the alienated parent, becomes kind of feeling guilt or scared or avoiding contact, this thing, all this happens. So child is going on developing conflict among themselves, the internal conflict, whether I'm doing right or wrong, what to do, what not to do, how to express my love, whether to express or not. That will lead to kind of anxiety in the child. So go to next slide, please. So where it develops constant vigilance in their mind. So what if the parent gets angry if I tell about this thing, or what if I'm disappoint them, or what if I love one parent, the other person I'm going to lose. This kind of permanent vigilance in their mind that induces the anxiety. This will lead to kind of chronic stress response in the child mind. So go to next slide, please. So what happens with this, slowly child started erasing their identity. So what they learn will be not been seen, because the child mother is especially loud, but it is not seen. It is kind of dangerous or bad or unloving, useless. So many dialogues will come. So they started doubting their own identity and starting erasing those things. So this kind of internal conflict, constant vigilance and anxiety and the erosion of their identity also leads to identity confusion. Go to next slide, please. So confusion comes out of that. Then they develop kind of what they started erasing their memories which are good for them, it was helping for their development. They start erasing, then develops kind of low self-esteem or blaming themselves, or difficulty to trust whom to trust, who is telling, the one person is telling this, one person is doing this, how to trust, whom to trust. That kind of confusion comes out of their mind, that leads to lot of impact on child's social and emotional development. So go to next slide, please. So with this, what happens in the child is, child slowly develop kind of loss and also going through grief reaction, like started distancing from that particular parent and lose one parent. Actually child requests both the parent, but during this process started losing one parent, not because child, the parent has died, it is because it is forced the child to choose one. So that happens in slowly, child started grieving themselves silently, and they don't know how to express that grief also to the, and they don't have courage to express also that, that goes very silently in the child emotions. Go to next slide, please. So, manifestation of this grief, loss of one parent, leads to so many things in the child. They started developing emotional numbness, that is difficulty to connect with the feelings, the what is real feeling. They get confusion whether it is whether to connect or not to connect, or they might develop kind of social withdrawnness, or sadness persistent, or increased irritability, because of so many emotional confusions is going on. So much energy they need to spend on these managing these emotions. Slowly their attention concentration will come down, their academic decline also will start. This is a kind of slow going impact happens on the child. So go to next slide, please. So, this emotional manipulation becomes normal over a period of time, because this because of manipulating behavior of one parent, they also learn. Yes, you should earn the love and affection through the manipulation, through the kind of fear or avoiding or not showing the real love. This uh, kind of understanding comes to their mind, and slowly they, as becomes teenager or adults, they also struggle with kind of abandonment fear. So what if I do this, they will uh, I will lose them, or how to control the other person. This kind of impact will come in their future life because of this kind of manipulation. So go to next slide, please. So what happens with this? They also develop kind of insecure attachment, or they might also have boundary issues, like difficulty to set personal limits, and withdrawing from their affection, or faking loyalty for a security, fear, rejection, so many bribing, so many things they will go through. Different kinds of emotions. Slowly they will have an insecure attachment. You know, we know how much impact of insecure attachment happens for the future life. They completely distorts their future work framework for their life. So the attachment issue is very important in early childhood, but because of this the kind of attachment loss happens. Go to next slide, please. Yeah, with this over a period of time, child kind of slowly drowned out of their voice. They are unable to express their voice, unable to express their feelings, which is real. So they feel that it is very unsafe to show their love, or force their they will be this, conflict will be going with to whom to choose, how to choose. It are forced to choose the parent. So becomes a kind of drowned out because all these between the manipulations and their internal conflict. Go to next slide, please. Yeah, I already said the kind of insecure attachment, difficulty to trust with the any parent, are unable to show their empathy. All this is an impact on the child emotional development. Go to next slide. It is also not only the emotional development; it also affect the cognitive development. Go to next slide, please. So, see, because of this, they started developing a kind of rigid belief. This is right, wrong, or they don't know how to reason it out. So that will lead to kind of thinking will be distorted, or problem solving will be affected. Like they don't know how to avoid the conflicts, so they're blaming others. Those things will come. Or, as already said, school difficulties, because going through a lot of emotional things, managing these emotions, they slowly decline from the academics also. So this kind of impact will be there on the child. Go to next slide. So it is not only the social emotional development or cognitive development, it also affect the behavior of the child. It may be through child started developing kind of aggression or hostility towards that particular parent, with the parent or peers, or withdrawing themselves, or some children cope up with the risk taking behaviors, especially if they are already vulnerable. So they try to cope up with substance use, or running away, or many other risk taking behaviors. So this is the kind of manifestations in a behavior due to this parental alienation. Because of they will be going through a lot of internal conflicts also. Go to next slide, please. So here, it also what we discussing is not the immediate consequences. It also affect the future adult consequences. It will affect their relationship instability, like the fear of abandonment. They're already going through, one parent is going to abandon because of the blaming the other parent. So that same thing will start imbibing in their relationship also. They develop kind of fear of abandonment because of this thing, and difficulty in maintaining intimacy. And also these children are vulnerable to choose unhealthy partners. That's how it affects their lifelong. And also the other mental health problems, like they may have high risk for developing depression or anxiety. PTSD is one of the important disorder because of this trauma, this emotional abuse. Silently, they are going through. They also develop personality vulnerabilities. The change of the enduring personality itself will change over a period of time because of this parental alienation. Go to next slide, please. Yeah. So for this, what we need to do is judiciary has to support shared parenting to overcome this. So that will help restorating this child's psychological balance and minimizing the manipulation, as well as it also helps the evidence-based protection of the child interest, also reducing the limitation the conflict. So, before going to this, I would like to tell what is shared parenting. Go to next slide, please. Yeah, shared parenting is something which happens post separation of this thing. Kind of parenting arrangements. Even though parents are living separately, both parents should continue to play actively in in a child life in a kind of meaningful way, and also take the responsibility in a child's life. It may be academic or development or financial support, anything of child's life. The parents continue to actively involve in the child life. That is called shared parenting. So, other words, shared parenting means it has child has a right to be cared or guided or loved by both the parents, despite their living apart. So, it is not that just because child is with one parent, it will lose the support from the other parent. It should not happen. So, even though they are living separately, both should contribute the well-being of the child. That is called shared parenting. Go to next slide, please. So the key principles of shared parenting is it is child centered, not the parent centered, where substantial involvement of both the parents should necessary. That is, it is not necessarily equal time. It is not that shared parenting means 1 hour with him, 1 hour with father or mother, or 1 week with them. It is not the time. It is the kind of involvement, like involvement in their educations or their health or their development. It is, and having a respectful communication between parents, even though they are separated in front of the child, they should have they avoid conflict between in front of the child, and avoid blaming each other. So ultimately, it helps in protection of the child relationship with both the parents. That is called shared parenting. Go to next slide, please. Yeah. So I already said that is not the 50-50 sharing of the time, splitting of the time. So, and also not forcing the child to choose any side of the parent, and not ignoring the safety concerns. So, like the child should not undergo any abuse, neglect, or conflict in a shared parenting. So, this is we need to understand shared parenting so that we can advocate for it. Go to next slide, please. Yeah, in shared parenting, the studies have shown that child feels loved and not divided, and it promotes the emotional security as well as stable attachment with the parents. Okay, then reduces the risk of parental alienation. So it will, in long term, it will affect their betterment of their health or academic or any other behavioral outcome. So it is proven, shared parenting is proven in studies, research, that it is at the best interest of child, it helps. Go to next slide. Yeah, why this judiciary has to support shared parenting? Because it will help the restorating the child's psychological balance, where because children need very consistent way of support or meaningful relationship. It helps in both parents are emotionally stable, and it should not be like dominating by one parent. So that's what it is very important to have a shared parenting. And also it is a corrective mechanism to prevent the child's psychological abuse. So go to next slide, please. So, and it also minimizes the manipulation or gatekeeping, like having a very important both equal involvement are avoiding conflict between them. So reduces the manipulation or controlling behavior of one parent, and also monopolizing the child's environment or child feeling perceptions also will be avoided in by doing this. Go to next slide, please. Yeah, so it is, I already said it is evidence-based protection to child best interest. So it will gives a higher emotional well-being in child and reduces the anxiety or other behavioral issues. Because of this, it also improves the academic performance in child. So it is very critical protective factor. Shared parenting is a protective factor in parental alienation. So it will avoid the fabricating the child's mind by one parent. Go to next slide. Yeah, and also it reduces the litigation or conflict. So shared parenting helps to reduce the uh, kind of time going in a litigation. So court also can have a kind of good reduction of the time going through this conflict of the parents. So go to next slide, please. So what we have to do is in the judicial responsibility in this parental alienation is early identification. That is something I can advocate is whoever going through this divorce or separation, court has to order early psychological evaluation of the family so that in the beginning itself, if we educate the parents how blaming each other or manipulating child's mind impact the child in a long run, so can be avoided, which is already happened, and then you correct it. So that's how we can understand the family in the initial itself, who is dominant, who is doing this kind of manipulation. So that early evaluation helps to identify parental alienation in the beginning itself, so that there will be structured observation will help parent child interaction, and also forensic assessment for this behavior. So this by identifying in early, and early intervention will helps child to protect in the beginning itself. Go to next slide. One is the early identification. Then court needs to order for issuing a equal parenting time or supervised transition if needed, like maybe if something going wrong, someone has to supervise and then give the correct information. As well, there is ordering for a compliant with the therapy. If child needs any therapy, both parents should involve and come for regular therapy, and also kind of neutral point to drop off, or kind of divided responsibilities. And also it helps in rebuilding the child bond with the parents with the shared parenting. So in suppose if they already have a conflict. Go to next slide. Yeah. So what happens if there is a willful alienation? So consequence should be very strict. Like if they despite warning, despite educating or evaluation interfering, they continue to manipulate. Courts should order for a strict enforcement or a reversal of this child custody, or contempting the proceedings or putting fine to them. These all things should be done through the judiciary urge. It is failure to correct it itself is a kind of enhancing the emotional abuse on the child. So should come forward through the court orders or through the involvement of mental health professionals in the initial part of it itself. Go to next slide, please. Yeah, so we need to judges or court proceedings should get benefit from the child psychologist and forensic mental health evaluators or mediators to train in a high conflict parenting, as well as there are consultants available for a shared parenting, how to do about it, how to go about the shared parenting. So this shared decisions making helps the court to reduce the time consumed for this during this process, avoiding the child for the emotional abuse of PAS. Go to next slide. Yeah. So it is judiciary must emphasize on the shared parenting because it is the constitutional safeguard to the child. This child right to get a right means safeguarding by the judiciary. So as well, shared parenting is a protective model, and it is child right to have a family, not the single parent. It should have both the parent, that is a family. And also the burden on the court also will be reduced with this advice of shared parenting as well. The impact of abuse also will be reduced. That's how the judiciary must advocate for the shared parenting in alienating. Go to next slide. Yeah. So this how what parental alienation we already seen is a kind of emotional and psychological abuse, especially in a high conflict separations. This include impact on child initially affect the development of cognitive, social, emotional, or kind of internal conflicts going into anxiety or long-term risk like depression, PTSD, attachment issues. All these are impact due to parental alienation. Should judiciary should recognize early in the early part of it and advise necessary interventions. Go to next slide, please. Yeah, so in that context, shared parenting is a very kind of safe, and it balances the thing, and as well as improves the bonding between the parents, and also helps enforcing parenting orders, as well as prioritizing this. Both the parents needs to be there for the child development. Go to next slide. Yeah, take home message is the parental alienation is a form of emotional abuse. Yes, even though it is not a hard, we don't see visible thing, but it is a silent abuse on the child developing mind. These children needs very safe, loving relationship. Not only single parent, it should be from both the parent. And early recognition is very important, especially from the judicial interference, and as well as shared parenting will protect the child for a long-term psychological harm. So with this, I uh, conclude my remarks. So, any questions from audience?
Thank you, ma'am. So we can take the questions now. Audience can unmute themselves and they can ask questions.
Yes, good initiative. Any questions?
We are not able to unmute. Are you able to hear me?
Yes, you can. We can hear you.
Yeah, ma'am. Excellent presentation. Very insightful. I was hoping to understand how to mitigate this alienation once it has happened. Usually, the people undergoing it realize it only after a couple of years or months. Very few people are lucky enough to realize this and try to prevent it. So, how do we overcome this alienation? What are the
Yes, sir.
guidelines to do that?
Yeah, as of now, the guidelines as such are not there. But what we can do is any separation or divorce is happening in the initial settings. How they do counseling to both the father or mother, like for reuniting, they do counseling, right? Family court, they do take some counseling session. During this phase itself, make the parents to understand the child custody, what happens, what kind of their dialogues are, their behavior are blaming the parents, are kind of seeding the child with their hatredness will affect the child. They can give the
Yeah,
insight in the beginning itself.
Yeah, it is right. I totally agree. But usually in this family court issues, people don't want to understand or even try to. They take it as a negative. Even asking for a psychological evaluation projected as a negative on the side of the requester. Usually, that is what in my personal experience. So, in those cases, we would have lost a couple of years. Alienation would have set in. So, how can we go about overcoming that alienation? Would you suggest anything on those lines?
Okay, sir. See, if there is a high conflict separation, we should keep in mind that this will going to happen. So we should initial itself we have to think of this might be a future problem arising, so that we have to urge the parents to go through the psychological evaluation, family evaluation, and as well. In the early phase itself, making the child also go through the counseling by the child psychologist or child psychiatrist. They can kind of uh, help they can take. That is one way. But in because I have not come across too many cases of these things, maybe. Real experiences whoever going through these kind of things can be explained.
Usually, people don't accept anything, even if it is a positive suggestion by the opposite side in these high conflict situations. So, in case making them agree voluntarily is almost impossible. Courts just don't take care. These counselings are all just a sham. So, after couple of years of alienation, we need to look at how to overcome it. One thing. Second is, as a professional, would you be counseling in such matters to overcome this alienation? Are you available for such services?
Definitely, sir. We can provide, but only thing is, uh, yeah, maybe not always online. Maybe one or two session offline we need to understand better. Then we can do online. Any consultation is required or counseling required.
Okay, thank you.
So actually, yeah, our system itself has any psychological assessment is required. Kind of stigma is attached, so
Yes.
that has to be reduced. It is mainly through the building awareness that seeking help is not the bad thing.
Yeah, true. But the
Seeking
reality is
help
different. Yeah,
is
overcoming all those things is difficulty. Even I have approached some doctors in Nimans themselves are not aware of parental alienation, let alone court.
Yes, sir. You are right. Even see, I have come across very few case during last for 5 years. But they don't consider it as need of help and seeking help. That's why we are not able to. Otherwise, the parental alienation is very prevalent in majority of the 90% of the divorce cases.
It's not recognized by law, so court doesn't consider it as an issue to be intervened. It is always considered only the parents' rights, and that way, children don't have a voice in such things. Of course, we
Yes.
have been active, and recently we have succeeded in getting Karnataka High Court to order shared parenting guidelines. Very recently on 15th, it's a
Mm.
positive this one, but psychological intervention and this lecture in particular, awareness like this is absolutely necessary because inevitably, even in intact families, alienation does happen. Maybe
Yeah.
that kind of awareness is necessary to mitigate it and overcome.
Yes. Yes.
Thank you, sir.
Yeah, it should be from judiciary part
This,
also.
We have a question from Nikhil and Sami. You can unmute and ask.
Yeah.
Dr. Natish, that's fine. Maybe I'll put my questions. So, Dr. Bhagwati, thank you very much for the presentation. Would be great if you can share the PPT also. It was quite insightful.
Sure.
I am here as a father who has been facing sexual molestation accusations, have overcome it, and now facing parental alienation. Issues are similar to what my other colleagues have mentioned, ma'am. One uh, is the child rejecting for some abusive behavior of the father, it's a parental alienation. I think that's the argument goes between the two sides and difficult to get the attention of the court that there's an alienation and that's why there's a need for uh, a child psychologist. So that's been a struggle in convincing the court, sailing through the accusation and there being a need to independently assess where there's whether there can be a psychological evaluation of a child. So that's the first struggle. Second is once the court gives there being an adequate child psychologist available who can do and rightly guide on the parental alienation. At this stage, I've been guided to use the child counselors through SCAN, which is a Tartisans initiative working with the family court. But those child psychologists, ma'am, unfortunately, are not well aware of the parental alienation. Many of the ways they're interacting with the child is in a way giving a confirmation to the child's thought process rather than giving an guiding him rightly that he's getting misguided and is getting alienated from the parent. So that's the few struggles I have, ma'am, and just wanted a few thoughts from you as to how to sail through these. One is explaining to the courts, and second, getting the right set of child psychologists for an assessment. And lastly, I think my colleague also asked how once it is how we overcome. I think that's the other difficult journey which we as fathers need to overcome.
Yes, sir. So what you pointed out very important things which come across. Thing is, many time judiciary not acting on it itself also a kind of what you say. It is also facilitating kind of abuse what is going on. That is one thing. The other thing is sometimes it is recognized as parental alienation. Sometimes we should not ignore the real abuse which is going on also. That also have to keep in mind. And depending on the child age and development, needs to be taken into consideration of directly interviewing the child. Give the confidence in the child, confidentiality, so that child is freely able to express. First, especially building a good rapport with the child, kind of few sessions to engage the child in a different form of assessment, not directly interviewing the child through talk. It is through the indirectly through the story based or art based, those kind of engaging the child will also get some clue what is happening with the child. Then we can go on to the proper interview rather than jumping into confirming the problem things are not. So that might help, especially family courts. They, I don't know whether they do have counselors properly trained in these things, and also they should additionally have a staff, a child psychologist in a regular staffing, so that it will help in these cases.
Yeah, hi, ma'am.
Last question, ma'am, before I maybe pass on is while you mentioned the impact of parent alienation on the child, ma'am, are there any research papers which you can share with us, which maybe we can use as a basis in explaining the short-term and the long-term impact which you mentioned? Are these based on some research papers you have relied on, and would you be happy to share with us so that we can maybe use it
Yes,
in a
sir.
relevant process?
Definitely. Along with my PPT, I will share those articles also, how it affects long-term anxiety, how it comes in a child, and depression and attachment, insecure attachment, and that will be a framework for a adult future relationship problems. So all that is researched, and there is articles. I will able to share these things.
Yes, Samir, you can ask now. You raise your hand.
Thank you, ma'am, for the nice presentation. I'm asking for a kid who is already 24 years old, a daughter, who is afraid of, like, as you said, taking the risk and going afraid of going into relationship because she's already been suffered from this alienation. Can you guide some tips because the time is very short, or can you suggest something? Because we have taken 2 or 3 sessions for the anxiety as such because she was facing, but right now, going for a relationships and taking risk is the like the biggest problem. Can you suggest something?
Yeah, what happens in this, especially children seeing their parents having conflict from the early age, and then going through the separation, and then going through these kind of experiences, definitely anyone will have the kind of avoiding to have any relationship, or they'll say, I don't want marriage in my life because I have seen lot of things in my own parents. So that is a common feeling, or a common mindset children will develop in their adult relationship. Yeah, it is mainly through exactly what they we have to split all their fear into different session. So what exactly they are fearing, like what made them to come to that conclusion, that analysis, kind of, it may be cognitive distortions, or it may be kind of psychoanalytical perspective. So it requires a very kind of long term sessions. Many sessions will be required to understand their perspective,
Mhm.
why
Right.
they come to this kind of decision. Then only we can step into it. There is no general advice for these things, unless because each individual going through different emotional reactions to it.
Right. Right.
We need to understand their perspective and then give the individual solutions for them.
Okay. Right. Thank you.
So, Praveen, you can ask.
Yeah, thank you. So, thank you for the wonderful session. Um, Actually, I'm also an alienated father, and I used to interact a lot of the fathers and the mothers who are alienated. Um, uh, so, my one point I would like to add up here is most of the parents who have the custody now, or like in a preconceived thoughts, they have the negative uh, kind of thoughts for the other parent, and then they used to label them by searching something in the internet and labeling them as a toxic parent or an NPD without diagnosing themselves or the other parent, and they control that situation to not to interact with the to not to interact the alienated parent to the child, and that harms not just the child but also the parent. I mean, who is the alienated parent? They go through like kind of, lot of emotional turmoil and like depression, anxiety, or even the PTSD kind of thing. Not just the child but also the parent, and
Yes.
that makes them suffer a lot. I have seen those parents, not just the child. Now, I mean, they used to suicide themselves. They used to, lost themselves in their life. Now, they may have some kind of, anxiety issues previously, which the custodian parent may not able to understand it. But at the end of the day, the parent who is ready to co-parent or who is ready to parent the child will go to the therapy, and that is what I think. But most of the custodian parent don't try to understand it, and they make themselves as a superior parent. They
Yes, sir.
represent themselves.
I'm very sorry to hear that you are alienated parent. Yeah, I can understand your perspective as what you are going through. Yes, there is 100% impact on the parent, alienated parent also, right? So because one trauma they're going through is separation, then another trauma, additional trauma is rejection by the child, and third is unable to prevent this, unable to control this, and so many judiciary process will come in a way between, and don't have a direct access to control this or minimize this. So all this will add on to the parent as well who is alienated, and they themselves also requires a lot of psychological support in these cases. So, as you rightly pointed, it is not only the child, it is also the parent who is alienated, also needs interventions, support, lot of psychological support, uh, because that divorce or separation itself is a kind of big trauma, and added these things will be causing more trouble in their life.
Thank you. Darshan, you can ask.
Yeah, hi. So, ma'am, my question is, like, when we hear from most of the concerns, right? The question is about the time duration where a parent is distanced from the child, right? So, considering the extreme allegations, extreme cases where there is danger to life and limb, or let's say sexual abuse, right? So, in these two categories, uh, what is the scope of some kind of credibility assessment, right? Uh,
What assessment, can you pardon, sir?
Credibility
Scope of?
assessment,
Mm-hmm.
right?
Okay.
So, sort of lie detector test, right, which is non-intrusive and which can reduce. I do understand and acknowledge that it is not conclusive evidence, right?
Yes.
And the
Yes.
right against incrimination protects a person from undergoing such test. But if in case one person is volunteering for to undergo such a test to either defend the allegation or to in order to protect the child, right? So
Yeah.
the question is centered around the child, protecting the child's rights or his safety, right?
Yeah.
So what is the such opportunity available through such credibility assessment?
Yeah, actually, these things comes into picture where we see a lot of things in movies or any other documentaries. We see hypnotizing test or lie detector test. So many things will be. They will fancy size all these things, but in actuality it is not through this kind of detector it's very indeterminate, you cannot come to any conclusion based on this. So basically, we have to kind of a thorough evaluation, both the family, both the parent, including child, and taking multiple resource information from the multiple resource. Uh, so everything has to be placed and then formulate the case, kind of proper deeper understanding in a it takes a lot of energy and lot of time and uh, sessions to come to understand these things. It has to go through very kind of maybe order from judiciary to assess both the parents, both, including child, and with the multiple resources. Maybe requires home visit sometimes, or taking into consideration of confidentiality of the child, or thorough checkup of the child itself. It may be through the multiple source. It is not just uh, one or two sessions we can handle these things.
Thank you, ma'am. Ian, you can ask.
Let Sandeep go, then I'll go.
Yeah, I just wanted to ask, what about you talked about shared parenting. What
Yes.
happens when you have got one parent which is very antagonistic and very toxic? In that scenario, shared parenting becomes very difficult. Very difficult. The
Yes,
parents
sir.
is
Actually, it should come from the judiciary so that if they are not following it, they have to face the consequences through the judiciary itself, the order from the judiciary. That might help rather than at the level of counselors. It should be order from the court to do some particular things.
very reluctant. In spite of you launching any number of kind of applications, they really don't go in the direction of counseling. Uh,
Yes, sir.
Rather,
It might be the person who is himself having personality issues or going through any psychological disorders. That also need to keep in mind.
yeah, and they run away. They run away from counseling, and the court is not even aware about that.
Yes, sir. We do see a lot of conflict, high conflict separation, where
Yeah,
one person will have a extreme personality disorders or extreme psychological issues. Very
yeah.
difficult to make them to understand or come to a conclusion or
The
protecting
kind
the
of
child.
parental alienation they do, the people who have got disorders, is very different compared to the normal parental alienation. They cross limits, they cross heights. The way they behave is absolutely nightmare. It,
Yeah. See, the separation comes in the background of the personality problem among the parents, right?
correct. Yeah.
That itself will complicate this whatever parental alienation or shared parenting issues, all that complicated through because of their personality disorders.
It also about the, I mean, dominating parent, no? And also about like the trust issues that they have developed between
See,
themselves.
that is the common layman word we give to dominating parenting. But what exactly that parent is having a problem, that that we need to look into. The
But
dominating parenting because of what? What is the psychological problem they are going through? They are themselves having a personality disorder or ADHD or some psychological disorders. We don't know.
yeah, I ready. I'm ready. I mean, very much agree because my ex-wife is an ADHD, adult ADHD child, and she might have BPD, what I have analyzed from my end. Uh,
Yeah.
but yeah, I think there is also a thing that I have identified because there are so many peoples involved in their marriage in Indian system. So they create a trust issue, a higher level of trust issues, which make them not to coordinate into a situation where they can coordinate for the best purpose of their child because
Yes.
of the where
Yeah.
multiple peoples are involved in that situation.
Ultimately, we have to look into best interest of the child, keeping aside their personality differences or their problems.
Because I have seen, I mean, I used to analyze various cases like Shekhar Kapoor is a very known, I mean, people we all know about it, and he was supposed to be an NPD. That her, I mean, interview that I have, I mean, her ex-wife interviews I have seen, and they are co-parenting their girl, and there are very various, I mean, personalities we can figure out in, I mean, Bollywood or in other I mean, Indian cinemas kind of thing, where they are in to I mean, public figure in a public. Their details are very public into the internet, and we can figure out those cases as well, where the other person who is very like not available or a kind of anxious or an avoidant kind of personality, and they still do their best to coordinate and co-parent the child. But the very first thing that I mean, I suppose the very first thing that is important to have that awareness or to have that initiative is to be done by the custodian parent, because the non-custodian parent is completely helpless for that situation.
Yeah. Yeah, you're right, sir. Yeah, see, to go co-parenting or shared parenting itself is a very complicated things. Needs a higher level of understanding what exactly it is and needs to be done for the best interest of child. To to come to this level of understanding, their personality should be intact. Their psychological mind should be intact. Then only it can be applied. So they themselves going through a lot of difficulties, then it is it is more of theoretical discussion rather than bringing it into practical thing.
Yeah. So we'll take one last question from here.
Yeah, thank you, Dr. Bhagwati, for this insightful presentation. So I am from Mumbai, the Western region. I would like to know what are the next steps that you would recommend in terms of obviously also creating this kind of awareness within the medical fraternity, because I've come across cases wherein there have been certain child psychologists who are not trained in parental alienation, who have gone ahead and given wrong reports to the alienating parent. The alienating parent has then gone ahead and used those reports to further, get adverse orders against the targeted parent. And obviously, as I said, this is defeating the entire purpose in terms of, getting help from the medical fraternity who do not understand the dynamics of parental alienation.
Yeah, you are absolutely right. Because no, uh, this is very vast when it comes to psychological understanding of all this. It is not something very limited. Each field requires expertization and deep going through many cases and understanding, and then getting an experience out of it. And whatever report they're giving should be very supervised by their seniors or advice from guides. Then only it should be taken into consideration, where judiciary can refer that kind of things to particular institution where some amount of training is happening in those kind. So where some guidance is available from the seniors, to instead of receiving each and every report from whoever claiming them they are child psychologist, that should be avoided. Maybe judiciary can refer to particular institute and get it done things
Unfortunately,
to
ma'am,
avoid,
as I said,
to avoid these kind of things.
unfortunately, ma'am, as I said, the judiciary themselves are not aware. And again, as I said, what they maximum at the best they do is they either advise it to the marriage counselor or the child counselor. Again, as I said, they themselves are not trained in parental alienation, so they are in fact furthering the cause of parental alienation because the child is not able to meet the targeted parent. So time is precious time is being lost. Again,
Yeah.
as I said, primarily my idea was to ensure that how once this membership form is being shared across by Dr. Natesh, how do we partner to create this as a pan India initiative? So if you could just throw some light on that.
Yeah, it's something a very big task you're giving to me.
No,
uh,
I mean, I'm obviously aware that this is something that will take a lot of time. But if you could, probably help us in terms of any contacts or kind of having more such sessions with your fraternity, with the medical fraternity, across pan India levels, because the idea is to create more and more awareness, more and more content, and accordingly, get everybody to work on similar lines.
Yeah, what we can do is maybe you're already having an association for these alienated parent. Anything is like such thing is there.
Yes,
So
ma'am,
like
there is.
how do we do parental associations and disabled child associations like that? We can have a association for these people and educate them at the same time. Advocate these things to judiciary also. uh, these kind things happens, then giving some contact details to them, they can contact these people when they are struggling, instead of just right away referring to someone at least who is experienced, or for them giving us some contact list. That way we can do, I feel.
Absolutely. Sounds good, ma'am. So we'll definitely be in touch, and obviously we'll try to take concrete steps in this way, so that obviously people from the medical fraternity at least are aware in terms of what's happening. So I thank you for your time, and I thank you for your wonderful presentation.
Thank you. Thank you.
And one
Even
last,
the learning exercise, actually, as you said, we come across, but there won't be any particular stream of training happening or guidance happening. That thing is not there. Even in our Nimhans Institute itself, we don't have such kind of training, exclusive training.
Absolutely. Yeah, I understand that.
Yeah. Thank you so
and,
much.
one last insight I would like to add. In a public image, or like in a public social uh, concern, there is a thing not just in judiciary that the mother is the default parent, or the best parent to have a custody, and that should also be changed, because I mean, uh, that is very like glamorizing one parent and demeaning the other parent, kind of thought that our society have, which like creates an identity crisis for a child.
Yes, absolutely. Yeah, that's how shared parenting is coming into picture. For not glorifying the one parent to have custody. So that's we have to urge for it.
Right, madam. Thank you so much.
Yeah.
As, one last question, if possible.
Well,
No
actually,
problem.
Yeah, ma'am. Is shared parenting or co-parenting possible when the dynamics are toxic? And as we mentioned, we have a person with a personality disorder, like a narcissism or something else like that. Is it technically possible? Because we are experiencing it, and it is like absolutely impossible.
See, nothing is impossible as long as we have to put an effort. But to some extent, we can help rather than having a pessimistic view, not having a hope. We should try put our best effort in the best interest of child.
Ma'am, actually, to answer his query, the alienating parent has to stop the alienating behaviors. That's when you can get into the aspect of uh, healthy co-parenting. Till the time that doesn't happen, obviously, with whatever minimal time you have, it's obviously called parallel parenting.
Yeah, taken.
Is there any program in Nimhans for such? Can you suggest any authority like HOD or somebody who can be approached to devise a program for this kind of intervention? Because some institution, authoritative institution is necessary for the coach
Yeah.
to refer. Probably Nimhans is the best one in Karnataka or Bangalore.
Yeah, yes, sir. When I was doing my training in child psychiatry, Dr. Shekhar Sheshadri, sir was very good in child sexual abuse and intervention, all that. And the same way, at present, he is retired, but still he is attached to projects there as a senior professor. Maybe he is one of the best person to approach, because they have one community program called Samvad. It helps for all kinds of problem. This can be given an additional responsibility to educate judiciary sector also, and people who are going through this process of alienation also can be included in that.
madam, you're correct.
Madam,
I
I
requested,
suggested one
spoke
thing.
with Shekhar sir. I have the articles about Samad clinic. I requested the same lecture on Samad clinics. So he said he's shifting to Guwahati, and he promised to communicate after Jack once shifting is fine. So there
Yeah.
is hopefully there will be a session on the Samvad clinic concept. There are a
Yeah.
couple of papers over there also. They have published it. The outcomes of summer clinic. It is there.
Yeah. They're doing a lot of training programs. That this can be included in the additional part of in this same.
Fine, ma'am. Thank you so much. Thank you, everyone. Thank you all the audience. Today was very interesting, very interactive session where we had the first time psychiatrist, a very qualified psychiatrist to address the issues. And thank you once again, ma'am, for that.
Thank you all. Have a
you.
good day.
This program we'll be having on Jan 9th, and it will be by Dr. Priyanka Nambia, who has published a paper on parental alienation. So we'll be keeping
Okay. I will attend regularly this program. Thank you so much to include me in this. Thank you.
Thank you, everyone. Thank you. Good night. Bye-bye.
Thank you.
Thank you,
Bye.
ma'am. Thank you.